Today we're going to talk about piercings for my informative speech. Now piercings can be either an earlobe piercing, which goes in the bottom parts of your ear, or it could be a body piercing, which could be any other thing else other than an earlobe piercing, whether it be a cartilage piercing, a face piercing, a piercing in your mouth, somewhere on your body or your genitals. Now, the process for these types of piercings differ. An earlobe piercing, they take a little piercing gun with the earring in it and they just poke it through your ear. When it comes to actual body piercings, they take the area that they're going to pierce, they poke it with a hollow needle and hook the jewelry on the end of the needle and push it through the hole. Now, healing time for both of these obviously are different. With a normal ear piercing, they normally heal within, it's usually about 2 to 4 weeks, and with anything else, if it's a cartilage piercing, it takes about a year to fully heal. Face piercings, a few extra weeks, maybe 6 weeks. With piercings in your mouth, it can be about 6 weeks, a month to 6 weeks, and the same with your body. Now, when it comes time to healing with your earlobe piercings, normally included in the price of the piercing, they give you this little ear piercing kit. It comes with this little solution that you put on a cotton ball or a Q-tip and you clean it off twice a day, and you do that for about 2 weeks and you're set. When you get a body piercing, what they usually recommend in shops is this. It's called H2 Ocean Spray. They call it piercing aftercare spray. They say on the can to spray your piercing 3 to 6 times a day. Now, whenever I have a new piercing, I usually try and do this 1 to 3 times a day. That being because if you do it 6 times a day, it's usually overkill. And this is killing the bacteria in there. That's good bacteria that helps your piercing actually heal. And that can cause infections as well. So I try and do about 1 to 3 times a day, once in the morning, once at night, and sometimes once in the middle of the day if I remember. There's another spray you can use. I found out that I had an allergy to a ingredient that's in this spray, so I can't use it anymore, so I have to use a saline spray, which is just like a spray that's usually used medically, but you can use it for the spray and it clears up just the same. Now, when you get a body piercing, there's also negative side effects that go with it. The biggest one is there's usually going to be some sort of a scar or scar tissue that goes with your piercing. But there's also ones that come with, such as infections. You can get tearing of your skin. According to WebMD, there's also problems with the jewelry, such as you have an allergic reaction, damage to blood vessels or nerves if you go in the wrong spot where you're pierced. And then there's the possibility of diseases such as hepatitis B or C, tuberculosis, syphilis, and HIV if non-sterile piercing tools or techniques are used. Now, this would mean that, you obviously, when you get a piercing, you want to go to a reputable tattoo or piercing shop. You don't want to try doing it at home. This runs way more of a chance of getting some sort of an infection or any of these diseases that listed. Now, according to AAFP.org, when it comes to a tongue piercing, normally you have swelling and tooth fractures because the jewelry hit your teeth or you bite on it. Minor infections, allergic reactions, and keloid formations come with ear piercings. Keloids being a small little bump. It looks like a little hard skin bump that can come with them. When it comes to cartilage piercings, more serious infections come, and ear disfiguration can come if it's a severe infection. Now, with these, if you have anything going on with your piercing, if you think anything's wrong, the best thing is to automatically go straight to your piercer. They'll be able to tell you if it's normal, if it's bad, or if you need to see a doctor, which hopefully you don't. Now, according to Explosive.com, when it comes to cleaning your piercings, like I said, use your sprays or your solutions, but when you take showers, you want to make sure that you get all your shampoos, your conditioners, your body washes. You want to try your best not to get that into your piercing, but if you do, you want to make sure you get warm water on there and you get everything out of it, because that helps. That can sit in there and that can cause bacteria that helps infect your piercing and upset it. When you clean mouth piercings like your tongue or a lip piercing, you want to use a mouthwash that comes with non-flavors and non-alcohol. This being, if there's alcohol or flavoring added to the mouthwash, these irritate your piercings and cause infection or swelling and prolonged healing time. Now with your lip piercing, if you do have one, on top of the mouthwash you want to use your saline or H2O since ready to clean the outside of it. And that is my piercing information video. Thank you all for listening. There's my audience.